Hi everyone, Dr. McLeod or Ryan here. So I've been thinking about this for a while and finally decided to try taking the plunge. Um, I really feel like medicine in Canada and maybe the world as a whole is really kind of at a crisis point. The demands on us and our time have never been greater. Um, the administrative burden has never been greater, and the expectations have never been greater, right? And burnout as it is at an all-time high. Things are very difficult for everyone, and we really do need doctors, for society to function well, right? So my idea, being a family doctor here in Hamilton, Ontario, in Canada, who has been through some difficult times and has really had to adapt, is to sort of, bring some of the lessons that I've learned and sort of distill them down in such a way that will be beneficial to other medical professionals, doctors, family doctors in particular, to hopefully help improve their practices and their quality of life as a whole. If this is something you guys want to see more of, comment below, hit that like button, tell your colleagues. The more that you do that, the more that the message gets out there, and the more people can hear it, right? So to just go over my story, I'm a practicing family doc in Hamilton, Ontario. I've been out of my residency for the past 10 years or 11 years. First 5 years I locumed, and that was good enough. I kind of did like 3 days a week and surgically assisted 4th day a week, and explored my own interests after that. And then I decided, my highest and best use of society was to take on a practice. So I took on a practice of 2,300 patients, and I knew it would be challenging, but I had no idea about half of the challenges that I would have to deal with. I got to some pretty dark places there, pretty low, just with the massive workload. You see like 30 patient equivalents in a day, and you get like hundreds of pieces of paperwork a day. And I got to a breaking point, right, where it was either just completely walk away from the practice or educate myself on how to become more efficient, more productive, take more time to take care of myself, and also not feel bad about taking that time to take care of myself. When you're getting on an airplane and they're telling you about, if the cabin were to lose pressure, they tell you got to put your own oxygen mask on first. Sorry about that. Because if you lose consciousness, you go down, you can't help other people, right? So as much as it's against our nature to put ourselves first, sometimes we have to, right? Unfortunately. And sometimes people just need to almost have permission to do that, right? So what I'm hoping to do with my channel is to sort of educate you guys on ways that you can work smarter, not harder. And a lot of this is, maybe if you're seeing very few people in a day because you're just so swamped with the administrative burden, maybe you can see more patients, but it's not necessarily about seeing more patients. It's a lot of the times it can be about, how can you take more time for yourself to get out there and, go to the gym, right? Meditate regularly, go to the spa, bring yourself down from that high negative energy down to a low positive energy where you're enjoying life and you're happy, and things are better for you and your patients too. I think back to when I started my practice and I was working 5 days a week, managing the practice, sometimes 6 or 7 days a week managing the practice. I was often, I'd come in the room and I'd be very, very grumpy, right? You had to have a bad day and you wear it on your sleeve. But when I started, taking some time out and, putting in boundaries and saying, hey, you know, I can't be all things to all people. I need to take some time out to come down to a more of a low energy positive state. Suddenly I think I was a lot easier to get along with, right? And I did get along better with, you know, colleagues and patients, not always, but it is what it is, right? So again, I'm hoping to sort of take a lot of the knowledge that I've learned. I've, you know, in learning about productivity, I've actually listened to hundreds of hours of podcasts. The Productivity Show by Asian Efficiency I do find to be excellent, high quality resource that you guys can listen to while you're exercising, while you're driving to work, while you're doing dishes, you know, just sort of the mindless jobs that you don't need to be doing. And you can learn a lot of pointers that are really helpful. But I was hoping to distill down some of the stuff that I've learned to sort of educate people on things that can be helpful for family medicine in particular, and for medicine as a whole, right? Be it if you're, hopefully it can be helpful if you're a family doc or a surgeon or a psychiatrist, you know, or a nephrologist. There's about 20 or 30 different specialties. Sorry if I left you guys out. No harm meant. So hoping that can be helpful. So one thing I would say is, you know, if you guys happen to see this and there's certain topics or things that you want covered, mention it in the comments section, right? And if I get enough people saying, hey, I want to learn about this topic or that topic, you know, I'll do my best to make a video of it. Ideally, I would like to get to the point of uploading a video a week. Obviously, with the busyness of a practice, not always going to be something that I can do. But you know, if I can do it, then hopefully that I can do that regularly, and it can be of value to you guys. Obviously this is my first video. I'm doing it on my cell phone, and you know, so it's going to be relatively low quality, but I'm hoping to week by week learn how to improve the quality of the videos, and get it up to the point where it's a very high quality video, and you guys can watch it and enjoy watching it and get some benefit out of it. So again, if you guys think that this is something that would be beneficial to you, if you haven't hit that like button, hit the like button, so then I know that, hey, like, people are interested in this, they want to learn more things, and you know, it'll motivate me to get out there and you know, produce more videos, right? Hopefully the quality will continue to improve, but maybe if I'm in a pinch and I need to upload something pretty quickly, maybe I'll just do a video, chat about things while I'm out walking, right? So maybe not all the videos will be high quality, but hoping to gradually move in that direction. Yeah, so like I said, if you guys have anything that you really want to learn about that will be helpful, that'd be great. I'd like to at least at the end of every video maybe give you a pointer that you guys can take forward and hopefully can you know, help improve things for your practice and your patients and everything going forward. So my first pointer is, and I'm sure a lot of you guys do this, but if you don't do it yet, I would highly recommend that you start making stamps for some of your most common things that you see people for, right? Like if cough and cold, if you haven't made a cough and cold stamp, you're going to be writing the exact same thing every single time you see something. You know, so if you can, you know, if you're writing the same thing every single time, it takes you 30 seconds or 2 minutes to do it, just make a stamp, put little colons so you can tab to it. At least in Practice Solutions, that's how you can do things. And you know, it's going to save you. If it saves you 2 minutes or 5 minutes 4 times a day, that adds up to a whole lot. I do personally have a lot of stamps of for common things that I see as a family doc. If you guys are really interested in having that, let me know in the comments, and I can see about making it available for people on Etsy. So yeah, so going forward, hopefully you guys can find this helpful. If this is something you want to see more of, comment, like on the video. If you don't like it, hit the dislike. If you really don't like it, hit the dislike button twice. So anyway, hopefully this can be beneficial to you guys. And yeah, together, you know, one doctor at a time will save medicine. Anyway, have a good one, and talk to you later.